Have you ever heard that fruit is nature's perfect medicine? For most of our lives, we've been told to eat more fruit. It's sweet, natural, and full of vitamins. But after age 60, things begin to change quietly inside the body. Your kidneys, liver, and blood vessels don't work quite the way they used to. And surprisingly, some fruits, even the ones we thought were healthy, can start to affect your brain and heart in unexpected ways. As a neurologist, I've seen how everyday habits can quietly increase the risk of stroke, especially in older adults. And in today's video, we'll gently uncover which common fruits may pose hidden dangers and why timing, portion, and combinations matter more than ever. This isn't about fear. It's about awareness and learning how to make better choices with the wisdom that comes with age. So stay with us to the end, because what you learn today could help protect not just your brain, but your peace of mind. Sometimes, the habits that feel the most wholesome are the ones we question the least. For many older adults, starting the morning with a glass of fresh orange juice feels like second nature, a symbol of vitality and good health. But for those over 60, especially anyone taking medications for the heart or blood pressure, this simple act may carry more complexity than it seems. Inside citrus fruits like oranges, especially in concentrated juices, lives a natural compound called furanocoumarin. While rarely discussed outside medical circles, this compound can significantly interfere with how your liver processes medications. According to research published in the Journal of Clinical Pharmacology, furanocoumarin can either intensify or reduce the effects of certain drugs, particularly statins, calcium channel blockers, and blood thinners by altering the liver's enzyme system, specifically CYP3A4. That means if your body holds on to too much medication, it can quietly lead to side effects like extreme drops in blood pressure, muscle inflammation, or unstable circulation. On the flip side, if your body flushes the medicine out too quickly, the drug may not work at all, leaving you vulnerable when you thought you were protected. I once worked with a patient named Elmer Bryant, age 79, a retired bus driver from Georgia. Every morning, Elmer drank a tall glass of fresh squeezed orange juice, my sunshine in a glass. He called it. At the same time, he was taking medications for high cholesterol and hypertension. Gradually, Elmer began experiencing dizzy spells and moments of confusion. One morning, he collapsed while getting up from his recliner. At the hospital, his scans showed a mild ischemic stroke. Blood tests revealed his drug levels were unusually high, not because he took too much, but because his liver wasn't clearing them properly. The daily orange juice, rich in furanocoumarin, had quietly interfered with his medication metabolism. Elmer was stunned. "I thought I was doing everything right," he said. And in many ways, he was, except for this one unexpected detail. So what can we learn from Elmer's experience? You don't have to give up citrus altogether, but it helps to make smarter choices. Swap full glasses of orange juice for a small splash in water to enjoy the flavor without the risk. Opt for clementines, which are generally lower in furanocoumarin, and avoid drinking citrus juice at the same time as your medications. These simple changes can go a long way in helping your body maintain balance as it changes with age, because in our later years, it's not just what we eat that matters. It's how it interacts with the rest of our lives. It's easy to believe that bananas are the perfect snack, soft, convenient, packed with potassium, and often labeled heart-healthy. For many, especially in younger years, that might be true. But as we age, our bodies process nutrients differently. And that same banana can quietly tip the balance in ways we don't expect. Potassium is essential. It helps muscles contract, nerves fire, and the heart keep its rhythm. But in older adults, especially those taking blood pressure medications or diuretics, often called water pills, the kidneys can struggle to regulate potassium effectively. According to the American Journal of Kidney Diseases, impaired kidney function is common after age 60, even in those without diagnosed disease. This means excess potassium may build up in the bloodstream without warning. When that happens, the heart can misfire. Blood vessels may constrict, and under the right conditions, blood clots can form, especially during the night, when circulation slows and hydration levels dip. One patient who brought this to light was Mr. Raymond, age 66, a retired carpenter from Ohio. He was sharp, active, and took pride in eating healthy. Every morning, he topped his oatmeal with a banana and took his blood pressure medication with orange juice, a routine he had followed for over a year. What he didn't realize was that this combination was quietly stacking the odds against him. One morning, Raymond's wife found him collapsed in the bathroom. He couldn't move his left side, and his speech was slurred. At the hospital, scans revealed a small ischemic stroke. Blood tests showed elevated potassium levels, which had interfered with his heart rhythm overnight and triggered a clot. 2 bananas a day, combined with his medication, had silently overwhelmed his system. So how can older adults still enjoy bananas without putting themselves at risk? A gentle shift can make all the difference. Instead of eating a full banana, try half in the morning, paired with a protein source like Greek yogurt or a small handful of nuts. This helps slow down absorption. Avoid banana-based smoothies or banana bread in the evening, and especially skip eating bananas before bed, when your circulation and hydration are at their lowest. It's not about fear. It's about understanding how our bodies change with time. Foods that once supported us may now need to be approached with care. And with just a few thoughtful adjustments, we can continue to enjoy what we love safely. And with confidence. There's something about mango that feels like a reward, soft, golden, fragrant, and full of summer sweetness. Many older adults turn to mango as a healthier alternative to processed treats, blending it into smoothies or enjoying it as a tropical snack. But under its cheerful surface, mango hides a few surprises that may not pair well with the aging body, especially for those on heart or blood pressure medications. Let's begin with the sugar. 1 cup of ripe mango contains nearly 45 grams of natural sugar, more than a glazed donut. For seniors dealing with insulin resistance, type 2 diabetes, or unstable blood pressure, this can lead to sudden blood sugar spikes, followed by sharp insulin surges and crashes. According to the Journal of Gerontology, these rapid shifts in glucose can cause inflammation in blood vessel walls, particularly in the delicate arteries that feed the brain. That inflammation isn't just a short-term reaction. Over time, it can create tiny cracks in the vessel lining. The body responds by forming clots to repair the damage, a natural defense. Yes, but a risky one in narrow, aging arteries. This is one of the less obvious ways a sweet piece of fruit can set the stage for a stroke. But there's more to mango's story. This fruit contains a natural compound called mangiferin, which, as noted in studies from the American Journal of Drug Metabolism, can slow down the liver's ability to process medications, particularly those that rely on the cytochrome P450 enzyme system. For someone taking statins, beta blockers, or anti-arrhythmia medications, this can result in drug levels building up in the bloodstream, unintentionally increasing potency and risk. I'll never forget one of my patients, Mr. William Booker, age 83, a retired firefighter from Nevada. He had always prided himself on living clean daily walks, home-cooked meals, and heart-smart choices. A few months ago, he swapped out his afternoon cookies for dried mango slices, thinking it was a healthy upgrade. But he was also on medications for high blood pressure and atrial fibrillation. Over the next few weeks, he started experiencing dizzy spells, especially in the mornings. One day, he collapsed while getting out of bed. At the hospital, William was diagnosed with a minor ischemic stroke. His blood pressure had dropped too low overnight, and his medication levels were unusually high, even though he was taking the correct dose. The culprit, the mango, had slowed his liver's ability to break down the drugs, quietly creating a perfect storm. So what can we take away from William's experience? If you enjoy mango, it doesn't mean you have to give it up completely, but try to keep portions very small. Limit it to a few bites, and only during the day. When your body is active, pair it with protein or healthy fat such as a slice of cheese or a handful of walnuts to soften the sugar impact. And if you're on heart, cholesterol, or blood pressure medications, it's worth having a conversation with your doctor about how mango fits into your diet. Because sometimes, the sweetest things in life need just a little extra care, especially when our health is in the balance. Watermelon is often seen as the perfect summer snack, juicy, sweet, and refreshing. For most people, it feels like a harmless treat. But for older adults, especially those on heart or blood pressure medications, watermelon can quietly create risks that often go unnoticed. Though it's made up of over 90% water, watermelon also acts as a natural diuretic. This means it encourages the body to release more fluids. In younger adults, this isn't usually a problem. But for seniors especially, those taking diuretics or ACE inhibitors, this fluid loss can lead to overnight dehydration. According to the Journal of the American Heart Association, even mild dehydration can thicken the blood, slow circulation, and make it easier for blood clots to form, especially during sleep. When blood flow naturally decreases, that's exactly what happened to Mr. Howard Larkin, age 82, a retired postal worker from Indiana. Howard lived simply, walked daily, and ate what he believed was a clean diet. After dinner, he often had 2 or 3 thick slices of watermelon to cool off and stay hydrated. What he didn't realize was that his evening habit, combined with his prescribed water pill, was pulling too much fluid from his system while he slept. One morning, Howard stood up from bed, felt lightheaded, and collapsed. In the hospital, doctors found his blood pressure dangerously low, and his blood tests showed signs of concentration and dehydration. He had suffered a small ischemic stroke, likely caused by a clot forming overnight in narrowed arteries. So how can you enjoy watermelon safely? Eat it earlier in the day. When your body is active and better able to regulate fluids, pair it with a pinch of salt or some coconut water to replenish electrolytes. And if you're taking medications that affect fluid levels, pay attention to subtle signs like morning dizziness or dry mouth. Because even a fruit that feels safe can become risky when your body's balance starts to shift with age. Pineapple often feels like a guilt-free pleasure, bright, tropical, and naturally sweet. Many older adults enjoy a few slices after dinner, believing it's a light and healthy way to end the day. But under certain conditions, this fruit may carry hidden risks, especially overnight. You see, pineapple contains bromelain, a natural enzyme that can affect how your blood clots. While small amounts may aid digestion, bromelain may also reduce platelet function, which becomes more serious when combined with blood-thinning medications. According to the Journal of Hematology and Thromboembolic Diseases, this can raise the risk of either clot formation or unexpected bleeding, both of which are linked to strokes in older adults. And then there's the sugar. Pineapple has a high glycemic index, meaning it raises blood sugar quickly. When eaten late in the day, that sugar surge can place added stress on your blood vessels, just as your body is winding down and circulation naturally slows. But one of the most overlooked risks is its acidity. Pineapple is one of the most acidic fruits in the American diet. In some seniors, it can cause silent acid reflux without pain, but with effects that reach the airway and brain. Studies in the American Journal of Gastroenterology show this can reduce oxygen to the brain during sleep, increasing the risk of early morning strokes. I remember a patient, Mrs. Clara Hughes, 77, from North Carolina. For over a year, she replaced dessert with pineapple each night. One morning, she woke up disoriented and slurring her words. Tests showed a small stroke, likely caused by the combined effects of sugar spikes, silent reflux, and bromelain. If you love pineapple, enjoy it earlier in the day, in small amounts, and avoid pairing it with medications that affect clotting. Because sometimes, it's not what you eat, it's when and how you eat it that makes all the difference. Grapes often feel like the perfect snack, sweet, juicy, and naturally healthy. But for older adults, especially those managing blood sugar or circulation, they may come with risks that are easy to overlook. Though small, grapes are packed with natural sugars that absorb quickly into the bloodstream. According to the American Journal of Clinical Nutrition, this sugar surge can trigger inflammation inside blood vessels, particularly those leading to the brain. Over time, this may weaken artery walls and increase the risk of clot formation. I recall a patient, Mrs. Jeanette Morris, 80, a retired schoolteacher from Missouri. Every morning, she enjoyed a generous bowl of red grapes while reading the newspaper, something she thought was part of a clean, natural lifestyle. One day, she found herself unable to finish writing a birthday card. Her vision blurred, and she couldn't recall the word congratulations. At the ER, doctors diagnosed a transient ischemic attack, TIA, a warning sign for stroke. Her blood work revealed sharp glucose. The issue wasn't just the grapes, it was eating them alone, on an empty stomach, and without hydration. This can make blood thicker, slow down circulation, and create the perfect conditions for clots to form, especially in older adults, whose vascular systems are already more fragile. To enjoy grapes more safely, keep portions small, about a handful, and pair them with protein. A few almonds or a slice of cheese work well. Avoid eating them late at night or first thing in the morning without food or fluids. Because when it comes to aging well, it's not only what you eat, but when and how you eat it that truly makes the difference. Cherries are often praised as a heart-healthy fruit, bright, antioxidant-rich, and naturally sweet. They're recommended for joint pain, inflammation, and even heart support. But for older adults, especially those taking blood thinners or daily aspirin, cherries may not always be as gentle as they seem. What many don't realize is that cherries contain salicylates, natural compounds with blood-thinning effects similar to aspirin. According to the Journal of Clinical Pharmacology, when combined with prescription anticoagulants like warfarin, Plavix, or even low-dose aspirin, these compounds can increase bleeding risk, sometimes to dangerous levels. That's exactly what happened to Mr. Daniel Rhodes, 84, a retired train conductor from Illinois. After a mild heart attack years earlier, Daniel had been placed on a daily low-dose aspirin and a statin, wanting to stay active for his great-grandchildren. He swapped out dessert for a bowl of fresh cherries each evening, encouraged by articles about their anti-inflammatory benefits. At first, all seemed well. But after several weeks, Daniel began experiencing daily headaches and fatigue. One morning, he woke up confused and vomiting. A CT scan at the hospital revealed a brain bleed, a hemorrhagic stroke. His doctors found no medication error. Instead, they traced the cause to the combined blood-thinning effects of his medications and the salicylates in the cherries. These interactions can be subtle. You may feel fine until you're not. And once bleeding begins in the brain, it can be difficult to stop and slow to heal. That's why it's so important to be mindful. So how can cherries remain part of your diet safely? Keep portions very small, and avoid cherry juice or concentrate, which deliver much higher salicylate levels. If you're on any medication that affects clotting, talk to your doctor before making cherries a daily habit. Because even something as small and sweet as a cherry can have a powerful effect in a body already working hard to stay balanced. As we grow older, our bodies begin to respond to food in new ways. What once felt harmless or helpful may now require more care and context. But that doesn't mean giving up on the fruits we love, it simply means learning how to enjoy them more wisely. Fruits like berries, green apples, avocados, lemons, and a small amount of pomegranate can offer real support to brain and heart health when eaten with thoughtfulness. The key is timing and balance. Enjoy fruit in the morning or early afternoon. Pair it with protein or healthy fat, and avoid eating it on an empty stomach or just before bedtime. By making these small changes, you give your body the stability it needs, not just to survive, but to thrive. So why not start tomorrow? One mindful choice at breakfast can set the tone for your whole day. And if you're ever unsure, it's always a good idea to speak with your doctor to find what works best for your unique needs. If you're still watching and feel these insights have value, please comment 1 below, or comment 0 if you feel there's something we could do better. Your voice matters. And if this video helped you, feel free to like, share, and subscribe so we can continue bringing thoughtful health guidance to more older adults like you. Here's to staying strong, staying informed, and living well, one smart step at a time.